Hello, friends, and welcome back to this channel. It's beautiful having you here. It's always wonderful to have you here. Very quickly, today we'll be discussing an interesting concept. We'll be talking about a disease called Lyme's disease. Lyme's disease is an interesting disease which is not popular in Africa but can be seen more in Northern America, in Europe, and in parts of Asia. Now, Lyme disease is caused by a spirochete bacterium called Borrelia. There are many species of the genus Borrelia, but the most important one is your Borrelia burgdorferi. Now, the Borrelia burgdorferi is a spirochete bacterium that has been known to cause Lyme disease. Now, how do human beings contract Lyme disease? Human beings contract Lyme disease when they are bitten by ticks, particular ticks, and there's the Aedes species of ticks that can bite humans and transmit this Borrelia into the human beings. Now, human beings are not really a host for this spirochete bacterium, but many times we refer to humans as an accidental host of this bacterium, and this bacterium can be very deadly. This bacterium is known to have an incubation time of about 3 to 30 days. And in these 3 to 30 days, when the bacterium finds its way into the human body, and like I said earlier, it only finds its way into the human bodies when the humans have been bitten by this tick. And you might want to ask yourself that how will a human get bitten by a tick? If humans handle rodents, handle deer, and handle birds, it's possible because many of these ticks attach themselves to either rodents, birds, or deers, antelopes and all of that. So if any humans who are engaged in hunting or any of these practices happen to handle any of these animals, these ticks can find their way to the humans from the animals. And like I said earlier, it has an incubation period of between 3 to 30 days. And you know what an incubation period is? That's the period between when you have the entry of this pathogen into the human and when you begin to see signs and symptoms on the human being. Now, some of the signs and symptoms that you would see for a person who is suffering from Lyme disease, one is a rash, a very big rash it's called an erythematous rash at the point where the tick has bitten the individual. And then you have fatigue, you have loss of appetite, you have weakness. These are some of the symptoms that can be seen and they develop. Now, it's also important to note that the bacterium, the spirochete bacterium, that's Borrelia, has various ways through which it tries to avoid the immune system. It uses antigenic variation. Antigenic variation is majorly what it does. It uses tissue invasion and then immunosuppression. These are some of the methods that the bacterium uses to try to avoid the immune system of the host. Now, it's also important to note that in Lyme disease, the clinical manifestation is in 3 stages. You have 3 stages. First, there's an early localized infection stage where when the bacterium finds its way into the human body, it spends a lot of time at the local site where the bite took place. It spends a lot of time multiplying in that site. It multiplies in that site and then begins to flow in the bloodstream, flow through the bloodstream, flow into the lymphatic system also, and begin to find different places to anchor and attach itself to. And that's when a lot of symptoms can be seen. The symptoms that are initially seen, you can have swollen eyes, can have this red patch, you can have fatigue, you can have weakness, you can have headache. These are some of the things that are seen at this particular time. Then there is a second stage, where is the stage of early dissemination, and then you begin to see skin conditions, you begin to see other neurological damages, neurological problems. You can begin to see cardiac abnormalities. That is, the bacterium can find its way into the heart and begin to cause problems with rhythm, heartbeat, and all of that, and begin to affect the heart in different and diverse ways, and it could lead to different complications. There can be complications like meningitis. You can have facial nerve palsy, like drooling of a side of the face, and you can also have other heart and abnormality conditions. And there's a condition called Lyme carditis. So you have swelling, inflammation of the cardiac muscle in the heart, the cardiac muscles of the heart, and this can really be a problem. And then you have the last stage where you can have real serious complications from Lyme disease. Diagnosis of Lyme disease is through clinical symptoms. Then you can do serological testing, you can do ELISA. These are ways to identify or to diagnose Lyme disease. It's an important disease. It's not really popular or common in Africa, but it's important for our knowledge that we know about it. Thank you for listening and do have a blessed and beautiful day. Thank you.